Hello and welcome to my channel. I'm Devin, also known as D the NP on all my social medias. I'm so excited to be coming to you today and talking with you about, no pun intended, a topic that is very close to my heart. I am a board certified family and cardiovascular nurse practitioner, and I'm a woman, and I'm a Black woman, if you didn't notice. You know, February was Heart Awareness Month, and March is Women's History Month. If you're anything like me, you don't have to look very far into your history to find some heart disease. And so that is what I want to focus today's talk on. Heart disease is a #1 killer of Americans. Heart disease and cancer are always the top two things that take the lives of people in this nation. Now, that doesn't really hit home to me, at least, in the same way as looking at my own personal and family history. Allow me to get a little bit personal with you when I say the following. My paternal grandmother died from a ruptured aneurysm at the age of 34. My maternal grandmother died from, quote, sudden cardiac death at the age of 58. My mother, and happy birthday, Mom. Today is would have been her 71st birthday. She died from congestive heart failure after suffering 2 aortic dissections at the age of 69. And then there's me, the daughter, the granddaughter, who was diagnosed with hypertension at the age of 26. Now, you know, for me, I was an athlete. I wasn't overweight at that time. And I was like, oh, my blood pressure's high, I'm gonna exercise. Oh, my blood pressure's high, I just need to keep running. I tried all of these different things, but at the age of 37, I became a nurse practitioner, and at 39, sat for cardiovascular boards. Everything changed when I started practicing in cardiology. I could no longer tell myself, oh, I just need to tweak this, I just need to do that. I finally understood that I have a predisposition to high blood pressure, and that high blood pressure is the foundation, the silent killer, the prerequisite for all of these other things that were going on in my family. I see this in patients all the time. My mother had a kind of heart failure that's called dilated cardiomyopathy, and that can come from many, many years of untreated or poorly treated hypertension. My mother also grew up during segregation. She also was a woman, and like her daughter, a Black woman. So there were times that she would present with symptoms and just wasn't properly diagnosed. I remember when she was diagnosed with heart failure at the age of 62, and she went to the hospital the first time and was given an inhaler as though she had developed asthma at the big age of 62 or had some other kind of breathing issue. And, you know, a lot of times people do associate shortness of breath and difficulty breathing with a pulmonary issue. I mean, it's breathing, breath, your lungs. I get it. But did you know that shortness of breath and difficulty getting a breath can be a sign of heart disease? It can be a sign of a complication with your heart. It can be a sign of blockages in your coronary arteries or pump failure. The actual ventricles of your heart not pumping as well. So that was a whole lot of backstory. If you're still with me, stay with me, because what I want to do to kind of marry this Heart Awareness Month that was last month and this Women's History Month that is this month is run through risk factors and signs and symptoms of heart disease. If you follow me on social media, and that's how you got here, or you listen to the Purple Stethoscope podcast, you know that I harp on establishing care with a primary care practitioner. And that is because that is your starting place. So if you're watching this video and you're like, well, I don't have a doctor, I don't have a nurse practitioner, I don't have a primary care provider, Now is a perfect time to consider establishing care with one. You can check out clinics near your home, talk to your friends and family for recommendations, or call the number on the back of your insurance card if you are lucky enough to have insurance, and ask them for a list of people who are contracted or in their network. I like the friends and family thing because those are the people that I trust the most. I absolutely have called the number on my insurance card at times, especially when looking for a therapist, but I don't want to derail. Let me bring it back in. So back to what I was saying, you want to have a primary care provider, somebody who knows you, knows your family history, knows your personal medical history, and that you can pick up the phone and make an appointment with when you're feeling off. If you don't have that, get that. Get that by doing the things that I recommended. Check out some of my shorts. I have these little 30-second shorts where I'm giving tips on how to find primary care, how to make an appointment, and how to get the most out of your appointment. So be sure to check those out. So back to what I was saying, risk factors. If there were 3 things I wish every woman, well, every person knew about their health, it would be their blood pressure, their LDL cholesterol, and their waist to hip ratio. I'm not a big BMI person because I'm a Black woman. I know I keep saying that, but things are a little different. I'm heavy. I have very high bone density that I know from doing a community health scan, and the person doing the bone density scans thought the machine was broken because of the way my reading came back. They were like, something's wrong with this machine. I'm like, no, baby, I'm Black. So, I weigh more. Now, there's a difference between weight and hip to waist ratio. You want a hip to waist ratio of 0.7 or less. So even though I'm a thickle, I'm blessed with that hip to waist ratio, which actually decreases my risk for cardiovascular disease, okay? Now, my blood pressure is perfectly well controlled now because I gave up on all that pushback about these crazy ways that I was going to cure my own hypertension. Didn't work. And now I take 2 medications every day, hydrochlorothiazide and spironolactone. So I know what my blood pressure is. I know my waist to hip ratio is in that 0.7 and lower range. But the other thing is your LDL cholesterol. And this is the cholesterol that we're most concerned with in cardiology. Mine's a little elevated. Mine's 116. It is it's a simple blood test that you get, and you can ask your primary care provider to order that for you. The recommended goal for blood pressure is less than 120 over 80. We used to say 140 over 90, and studies were, longevity studies were done over time, and we recognize that there's actually an increased, significantly decreased risk for cardiovascular events in folks who keep a blood pressure of less than 120 over 80. So that's goals. You want your LDL cholesterol less than 100, unless you have a history of coronary artery disease. Then your goal is less than 70. Okay. So yeah, I understand. I'm up, okay? And it's diet, it's lifestyle for me. There are people who are super thin, who are super active, who naturally have really high cholesterols, and I want to make that distinction. You cannot judge your health based off of your size. Please don't do that. As somebody who sees cardiovascular patients every day, I will be the first to tell you that I am shocked sometimes at these little itty bitty 110-pound people with these 200 plus LDL cholesterols. On the same token, I have run tests on people who, look like they could push that plate away from time to time. I'm not, body shaming or nothing like that, but I could push that plate away from time to time, but I digress. And their numbers come back completely fine. So don't make the mistake of thinking because you're big or because you're small, you have or don't have certain risk factors for cardiovascular disease because you don't know unless you know. So establish that relationship with your primary care provider. Know what those numbers are. If I had to throw a fourth number in there, it would be your hemoglobin A1C. And that's the gold standard test for diabetes. So know your blood pressure, your cholesterol, your hip to waist ratio, and hemoglobin A1C. Never hurt nobody. Diabetes increases your risk for heart disease. There's a wonderful collaborative website from the American Diabetes Association and the American Heart Association called knowdiabetesbyheart.com or .org. I don't know. I'll put it in the description box. But let me get back to what I was talking about. Risk factors for coronary artery disease. Okay. Or coronary heart disease. You may hear it like that. Clogged arteries is what we're talking about. Plaque, okay? Age. You can't do a dang thing about your age. The older you get, the greater your risk for heart disease, okay? So, those of you who have grandmothers, grandfathers, great-grannies, aunties, and uncles, ask them, what's your blood pressure? What's your cholesterol? You know. And help them, walk this walk with them, because we lose so much years in relationship. Well, I never met one of my grandmothers, and my other grandmother passed when I was, oh gosh, it was in the 80s. I was a kid, you know, so I didn't get to build that relationship. So do yourself a favor, do your kids a favor, and check in with the elders in your family. Age is a risk factor for coronary artery disease. Gender is a risk factor. Men, this is where it gets goofy for me. Oh man, I was trying not to make this video forever long, so let me not, okay. Gender is a factor, okay? So men tend to have more incidence, but women have worse outcomes. Women are more likely to die from a heart attack. Women are most likely to be dead a year after a heart attack. Women have a lower incidence, but a higher mortality for so many different reasons. First of all, we talk ourselves out of everything. Oh, we will talk ourselves. We ain't got time for that. Ain't nobody got time for no heart attack. I don't have time for a casket, and I hope you don't either. If you don't make time, life has a way of making time for you, of sitting you down. So that's one of the reasons, because women, we tend to present later. We have a lot of responsibilities that are not captured, and we are not the poster children for heart attacks. So when we have symptoms, which can oftentimes, I hear from women that they had nausea, stomach upset, a little nausea, a little vomiting. Ladies, if you don't have the flu and you're not pregnant, it's not normal to just start throwing up and sweating. Just putting that out there. Can be a sign of a heart attack. Also, you know, we tend to play our symptoms down. That pain scale changes when you push a watermelon out of your, well, okay, so the pain scale. We ask people to rate their pain on a scale of 0 to 10, and it is subjective. Women are some soldiers. We will tell you the pain is not that bad, when it's that bad. So I encourage women to present and to not, you know, talk ourselves out of symptoms. Some stuff just ain't normal, and we know it. We know it's not normal, but we, you know, we'll try to, kind of like we do with our partners. Yeah, we be knowing. Anywho, back to some of these facts about women. Cardiovascular disease is the #1 killer of women, causing 1 in 3 deaths each year. 1 in 3 women that die in 2022 will die from cardiovascular disease, okay? Cardiovascular disease impacts women, some women at higher rates than others. Heart disease and stroke can happen at any age. Any age. Now, these strokes, I talk about heart attacks. These strokes, let me tell it, a stroke is worse than death to me. A bad stroke where, you lose your ability to speak, you lose the function of one side of your body. I will take cremation for 500, Alex. Debilitating. And if you know anyone who's had a stroke, especially if you have a family history of stroke, please pay attention to your blood pressure. Please pay attention to your cholesterol. And all right, secret. I loved smoking. Oh, how I loved me a menthol cigarette. I quit smoking a decade ago. I still be wanting a cigarette. I wouldn't mind having a cigarette while having this conversation with you all. But one cannot work in cardiology very long before realizing that there's nothing good that comes from smoking. My mother managed to have 2 aortic dissections without being a smoker. So I know that's not it for me. Smoking is just not it for me. Miss it, loved it. Gained weight when I quit. I mean, all of the things, but with my family history and my personal medical history, just not worth it. So if you smoke, vaping is not a substitution for smoking. Vaping is not a substitution for smoking. I've heard patients tell me all kinds of things. There's only this much nicotine in it. You know what goes in your lungs? Air. Air should go in your lungs. Nothing else. Nothing else. Don't be inhaling stuff. Don't do that. Hookah. You want some carbon monoxide poisoning and have a late diagnosis because it can take a while for people to figure out what's happening. Yeah, hookah, not the thing either, not the business. I know it's cute. Y'all are so cute. I watch y'all with your little hookah and your little smoke it. It's so, I don't know. I think it's sexy. I'm weird though. Some people find it to be a real big turnoff, but I kind of think smoking is sexy. It's not sexy to your heart and your vessels. So stop that if you're doing that. And if you're smoking weed, this is when they really hate me. Switch to edibles. There are a million different types of edibles. You can have a quick onset with a tincture. All of these different things, folks will try one type of edible and eat half a candy bar because they don't know what they're doing, and then come back to me and follow up and be like, I'm never doing that again. That was the worst thing ever. And I'm like, yo, I told you to check it out. I didn't tell you to go eat half of a candy bar. There are classes, there are professionals. One of my favorite people is my girl Melinda at Mary Care Wellness in Maryland, and she does excellent teaching on this topic. But yeah, don't just get out there not knowing what you're doing. Get your information and try something different, because smoking ain't it. Okay. Cardiovascular disease kills more women than all forms of cancer combined. Breast cancer, lung cancer, colon cancer, ovarian cancer, uterine cancer, cervical cancer. You can combine them all. It's heart disease. Heart disease is a thing. Yeah, get your screenings. I'm not saying don't do your mammograms and your PAPs and all of that. Do all of that. But don't ignore your heart, because the thing with heart disease is it's sneaky. You don't have symptoms necessarily. Okay? You be going along one day and suddenly you have this pressure in your chest, so you stop and you sit down and the pressure goes away, and you get up and you try to get back to it and that pressure comes back. That is your heart, boo-boo. But we're not taught that. So yeah, among women 20 years and older, nearly 45% of us are living with some form of cardiovascular disease. Okay, that's getting depressing. These are some statistics, and I'll put them in the description as well on Go Red for Women from the American Heart Association. But I'm gonna put that down because that's getting a little bit depressing. Yeah. So back to risk factors. There's modifiable risk factors and there's non-modifiable risk factors. 3 things about me I can't change. I'm a female, I'm Black, and I'm getting older. I can't change those things. Those are my non-modifiable risk factors, okay? I can't change my parents either, nor would I. I was so blessed. I had amazing parents. Um, anyway, yeah, so those are your non-modifiable risk factors. When it comes to your modifiable risk factors, that's going to be smoking, drinking. Yeah. Y'all, I don't want to sit here and talk your ears off all day. But drinking, maybe that's a subject for another day. And, the heart don't like alcohol. I'll just leave it at that. American Heart Association says men can have 2 drinks a day. Women can have 1 drink a day. Most of us don't know what 1 drink is. So, check that out. Look into that. But the heart doesn't really like too much alcohol. So keep it tight. Keep it cute. Keep it in moderation. We said smoking, we said drinking, weight and physical activity. I don't like weight. I don't like using weight as a marker for the reasons that I said previously in this video. What I will say is move your body, get up, get up, get out, and get something, do something, remix, get up, get out, and do something, move. Park your car further away, walk around your block a few times, walk as much as you can. Sitting is the new smoking. That is the title of a Time magazine article that I invite you to read, which also states that it takes 1 hour of cardiovascular exercise to mitigate 8 hours of sitting. So if you got a desk job, you got to break that 60 minutes up, get up, go for a 15-minute walk on your breaks, talk to your homegirl on the phone, do whatever you need to do, but move your body, okay? I am blessed that I have dogs, and my dogs love to go for walks. So I have actually done 30 minutes of my walking already today because, the dogs will bring you their leashes and their harnesses, and however you need to move. Dance, put your playlist on, clean your house, pick up, move your body. Just don't, sitting is the thing we want to avoid. Cardiovascular exercise, I don't like to get so technical on where your heart rate needs to be and all of this and that because it's a lot of work. I've never been a calorie counter, heart rate monitor type of person. Just move. We can just start there. Abdominal obesity. If your waist is greater than 35 inches, ladies, no matter what your hip to waist ratio is, do what you can to whittle that thing down. Some of this is frustrating for me to kind of read through and go through because I got hips. Literally just got them under 50 inches. So 49 inches. It helps to have hips when you're doing your hip to waist ratio, but 35 inches in the waist, we got to start tightening it up. Ooh, cute tip, waist beads. I wear waist beads. I have been wearing waist beads for almost a year now. And, I lost 14 pounds after I started wearing waist beads, and then I tightened them. Let me tell you something. Waist beads, not only are they cute, they are terrifying because when they start to get tight, you're doing too much. And, you want to reach for that second cookie and your waist beads be like, okay, girl, I will bust and roll all over this floor if you don't stop. So yeah, waist beads is a really cute, easy way to kind of check in with yourself and be in your body and know, whether or not you're doing too much. And that kind of takes out, weighing yourself and measuring yourself and doing all of that stuff, which has value, but it can be hard. As a former athlete, as somebody who was obsessed with my body fat percentage, got it so low that I didn't even have periods at one point, was completely unhealthy, but folks would have looked at me and been like, oh, okay, she's healthy. I was not. I have some issues surrounding measurements and numbers and all of that stuff, but waist beads, real cute way to keep a tight watch on that and be cute with it. Diet. We need to eat our vegetables. If it doesn't go bad on the counter in a week, is full of preservatives, and preservatives are full of sodium. Where salt goes, water follows. Salt plus water is weight and congestion, and it makes your heart have to work too hard. So cut back on the processed foods. That's where 68% of our dietary sodium comes from processed foods. Not the salt shaker, not occurring naturally in food, not eating out in restaurants. All of those things add up to the total amount of your dietary sodium, but almost 70% of your dietary sodium comes from processed foods. What do I mean by processed foods? I mean, if it doesn't go bad on the counter in a week. I mean, if it comes out of a box, a can, a bag, the freezer section, those sort of things, okay? So we need to eat less of that, eat more fruit. One trick that I have for fruits and vegetables, walk around the organic section in your store, see what is in season. And even if you can't afford to buy the organic stuff, which I certainly can't because I have teenage boys up in here. No ma'am. And folks are like, oh, you're a medical provider. You're a nurse practitioner. Yeah. And I'm living real humbly because my boys eat. So I can't get the organic stuff, so I look in the organic section to see what's in season, and then we'll buy that in the regular section or at the farmer's market or whatever, because I know that the chances of all that fish scale hybrid kind of thing is lower. More fruit, more vegetables. I love me a good smoothie. In fact, a lot of times I'll just pick up a fresh smoothie from our little juice store when I'm coming home from work and realize it's not been a vegetable in sight, that I have just been nibbling and snacking and chewing on things that, weren't green. So eat the rainbow, eat the color of the all the colors of the rainbow if you can, and fill up on that stuff first. I love Weight Watchers as a program because they have different plans that you can choose that have 0 point foods, and a lot of those 0 point foods are your vegetables. So yeah, if you're thinking about you need a little more help than just me hollering at you talking about eat your vegetables, I think Weight Watchers is a great way of eating because again, depending on the plan you choose, you don't have to micro manage your food. For a lot of us, that is a slippery slope into some really unhealthy behaviors. So there's that for whatever it's worth. Get your fiber. You should be pooping. If you're not, that's a problem because food in, food out. So eat your high fiber foods. I talk about fiber like fiber are the cars. Water is the freeway. Sometimes the cars on the freeway get backed up. You need a little more freeway, a little more water. Sometimes, the freeway is nice and clear. There are no cars on the freeway. On an average day, a good day when everything's going well, you got traffic and movement. And that's how your bowels should be, traffic and movement. If you're eating, you should be pooping. And if you're not pooping, eat more fiber, drink more water, bada bing, bada boom. Okay. We talked about cholesterol. Cholesterol can be hereditary or dietary, like I mentioned. It could be a combination of both. You don't know what your cholesterol is unless you test it. So ask for a lipid panel from your primary care provider. Hypertension is a risk factor. High blood pressure. Y'all know how to know if your blood pressure is high? You take it. That's it. That's how to know. You take your blood pressure and it's high. Now, I don't love starting people on medication right out of the gate. Sometimes it can be necessary when there's so much going on and we're trying to prevent you from having a stroke. Sometimes it can be necessary, but you can monitor your own blood pressure. Get you an arm-on upper arm cuff, $35 to $50 on the Amazon or at the Walgreens or the Walmart or the whoever, and take your blood pressure at home at different times. Random spot check it. Is it higher than 120/80? Is it consistently in the one? My blood pressure without medication was consistently in the 150s/90s to 100s. Baby girl was begging for a stroke, begging for some heart trouble. But no, she takes her medicine. Yes, she does. And it's good. It's good. So hypertension absolutely can be a cause for heart disease. Okay. Psychosocial factors, stress, depression, anger management. Y'all, I don't have nothing for you. I practice yoga myself. I like to get outside and move. I love to ride horses. I am like constantly seeking out, practices of peace, because I need peace in my life. I have a high stress job. I told you I got these kids. I got a whole nother one too. I got a grown daughter, teenage boys, 3 dogs, a husband. Love you, babe. He's cool. He's real cool. And, family stuff. Life is stressful. I believe the world's on fire right now, the last time that I checked. That takes a toll on us. And so we have to be intentional about stress management. We have to be intentional about having things in our lives that we do that help us to have some peace, for that tension to come down. Hyper elevated. Hypertension, lots of tension. Okay? We got to relax. So, and then, alcohol consumption. 1 drink is 12 ounces of beer, 5 ounces of wine, or 1.5 ounces of 80 proof liquor. And then lack of regular physical activity. Those are all risk factors. Now, what I want to get into, I'm going to end it with this. These are some signs and symptoms of a heart attack, okay? Chest pain. That's the one we all know, chest pain. We've seen it in the movies. The guy clutches his chest and drops and his legs kick out, and, they come out with them paddles that nobody has used since the 70s, 80s. Actually, a heart attack can sometimes just be that pressure that I was talking about earlier. It's like a pressure, not necessarily a pain, but a heaviness, a dull ache. Anything like that, especially if it's worse with exertion, worse with movement, exertion, exercise, and goes away with rest. Red flag, we need to see you down at the clinic. Now, shortness of breath can also, like I mentioned, be a sign of a heart problem. Again, if it's exertional, that's very concerning. Goes away when you rest, gets worse when you work. Now, you know what I hear all the time from my patients? My patients always tell me, well, I'm out of shape. Baby, we are all out of shape. We have all been sitting in our homes and avoiding other people for the past years. So don't talk yourself out of your heart attack or your coronary event. Don't do that, because if something's not right, you know it's not right. You live in your body. You know your body. You know what you normally feel like, and you know what's not normal for you. So don't start this whole, well, I'm out of shape. Well, I did put on 7 pounds. Well, I am a smoker. Well, Nah, you develop chest discomfort like that, we need to hear from you. If you can't lay flat, like you lay flat in the bed and you can't really breathe good, so you're propping yourself up with pillows or sitting in a recliner, or your auntie or your granny or your mama or your daddy is doing this, that's a sign. That's a sign that they might have some congestive heart failure or weakness in the heart. So don't sleep on those things. I can remember when I was a little girl, I used to think it was so beautiful the way my mother's, she had this vein in her neck that would bulge. I could see her heartbeat in her neck. And I used to just, as a kid, just go sit and look at her. And I thought that was the coolest thing. I don't think it's any coincidence that I work in cardiology, y'all. I've been obsessed with pulses and heartbeats. And anyway, now as a cardiovascular nurse practitioner, I know that jugular venous distension and is a sign of volume overload, fluid volume overload. Water is heavy. Water is heavy. And, you know, a lot of times when people are gaining weight and they're not eating a lot more, that's a sign that they're, you know, backing up with fluid, getting congestion. So if you can't lay flat, that's a sign that you need to come in and be evaluated. If you're gaining weight without eating more, that's a sign. And especially an advanced sign is like loss of appetite, especially with weight gain. Those are some reasons that we need to see you down in cardiology. How do you get to cardiology? Through primary care. Through primary care. It always comes back to primary care. So establish care with a primary care provider. Find out what your blood pressure is, what your cholesterol is, particularly your LDL cholesterol is of interest as it relates to your heart. Know what your hip to waist ratio is. You can measure that with a tape measure. Divide your waist by your hips. 0.7 or less is what you're aiming for. Get you some cute waist beads, ladies. They actually do help. Like I said, I lost 14 pounds when I first got my waist beads and have kept it off because I wear them and tighten them as I need to. And what else? Quit smoking, cut your drinking down. Get you some self-compassion behaviors that really are you being kind to you and allowing yourself some rest, okay? My name is Devin. I'm at D the NP on all my social media. My podcast is called The Purple Stethoscope. And this is really important information that I'm really grateful to be able to share with you today. This is also something new that I'm trying, this whole YouTube thing. So I'll get better at it. I'll get better at it. Typically, I just meet with patients in the clinic and talk to them just like this. And since I can't meet with you and meet with all of you individually, I thought I would just record a little bit about heart health, and especially as it relates to women. Happy Women's History Month. And if you want to do something special for yourself, do the things that I mentioned. Establish care, find out what your risk factors are, and start working on those things so that you can live long, live well, and, you know, add years to your life because your family loves you. And your friends love you, and we love you, and Lord knows the world needs women, and healthy women at that. So a lot of the stuff I mentioned, I will drop in the show. I always say in the show notes because I'm used to podcasting, sorry. I'll drop in the description box. And I hope to see y'all around these parts later. Leave me some comments. Let me know what you learned that you didn't know. Let me know if you made an appointment with your clinician and asked for these tests that we talked about. Let me know what your blood pressure was when you got your little upper arm cuff and you started taking your blood pressure. Let me know what you found out, y'all, in the comments, in the comments, in the comments. Thank you for hanging out with me. And let me know what else you want to hear about, what y'all want to talk about, what you want to know. Until next time, eat fresh and dance. Bye.